Welcome everyone, whether it's morning, noon, or night, wherever you may be joining us. My name is Joel Dreyfuss. I'm a journalist and I'm a moderator for this webinar, which is convened by United Surgeons for Children. The COVID-19 pandemic has forced us to examine the performance and structure of our global health system. This year, during the International Year of Healthcare and Care Workers, it is more important than ever to fight for a stronger and more equal foundation for health systems globally. Join us as we highlight strong female figures who contribute to the global health workforce and the actions we must take to continue to empower this community. Just before we get going, just to remind you, the session is being recorded and we'll be taking questions at the end of the program. We urge you to use the Q&A feature to submit your questions throughout the session. Our topic is empowering women in global health. And you have 4 great panelists for you. Anushka Finker is Director of United Surgeons for Children in the US and CEO of La Chaîne de l'Espoir in France. Based in Paris, she has over a decade of experience in international fundraising while also providing strategy and operational guidance for the organization. Dr. Laurence Boutin Andreu is the Deputy Medical Director at United Surgeons for Children and coordinator of the Haiti program. She is also Vice President and co-founder of the Necker Institute of Pediatrics in Haiti. Dr. Michelle McIsaac is an economist and health workforce specialist at the World Health Organization. She also chairs the Global Health Workforce Gender Equity Hub alongside Women in Global Health. And Dr. Susan Garfield is EY America's Chief Public Health Officer and Health Sciences and Wellness Sector Commercial Lead, where she works with with life science clients in pioneering strategies and commercial transformation programs. Since United Surgeons for Children is the convener of this event, I'm going to let Anushka give you some basic background on the organization and get us started. Anushka.
Thank you very much, Joel, and welcome to all of you across the world. United Surgeons for Children is part of the international NGO, La Chaîne de l'Espoir, based in Paris. Since 1994, we have offered direct surgical care for children and also women, trained local medical staff, constructed medical facilities, and provided health education courses for children in more than 30 countries around the world. Much of the work that we do impacts women. In Afghanistan, USFC opened a maternal child health hospital to provide direct medical care for women. Afghanistan has one of the highest mortality rates in the world, and fewer than 60% of births are overseen by skilled health professionals or midwives. In Haiti, USFC operates a nurse training program for women in which we train 35 nurses each year. Laurence Boutin is here today to share more about this program. And we choose to convene this event to promote the creation of opportunity for women in the healthcare workforce and celebrate women in health. Thank you, Joel, for joining us today and agreeing to moderate this discussion.
Here.
Joel,
we cannot
hear you, Joel. You are on mute.
Sorry, here I go. Technology strikes again. I was going to start with Dr. McIsaac. Why is gender so important in the healthcare workforce?
Hi, thank you for having me. It's a pleasure to be here and to discuss such an important and relevant topic this year, which is the International Year of the Health and the Care Workers. So I think the question around why gender is so important in the health workforce is a really sometimes overlooked one, but very, very obvious as to why, which is that the health and care sector is one of the biggest and fastest growing employment sectors in the world. And health is such a feminized sector. And this has particularly important implications for women's economic outcomes in the grander scheme. Women comprise around 70% of social health and care workers globally. But what we see when we look into it is that the jobs, the types of occupations are not uniformly landscaped at 7 out of 10. Rather, what we see is that women are typically clustered into lower status, lower paid jobs in health and social care, and that this is the sort of typical men are surgeons and women are nurses stereotypes, or what we may refer to in technical terms as occupational segregation by gender. But what we know is that when we really investigate this, that this divide, this gender gap goes even deeper than just this kind of occupational segregation in health. And what we see is that within occupational groups, so that's within the same group of occupations, so let's say physicians or surgeons or nurses, contract modality, so this is the type of contract that the worker holds, can differ by gender. What's really interesting is that when we look at highly paid occupations such as physicians and surgeons, men are more frequently employed in the private sector than women. So around 50% of men globally in these sort of higher paid occupations are in the private sector, whereas women it's around 40%. And this is often the case in countries where there might be a wage ceiling in the public sector. However, the exact contrary is the case for the lower paid jobs, such as personal care workers, where women are more frequently employed in the private sector. So almost 80%, over 80% of women in these sort of lower paid jobs are in the private sector, where it's only around 53% for men. So what we also know is that in addition to the kind of contract that these workers hold, there's also the hours worked. So women are much more likely to be in part-time employment than men. And this is important because at current, we still have a lot of Social Security tied to our jobs. And so this sometimes means that women aren't getting access to the Social Security. We also observe a gender pay gap in health and care, both overall, which accounts for this occupational segregation, but also within occupations. So we know that in most occupations, in most countries, men are paid more than women for the same work. And WHO and ILO are launching a big report on this later this year. Gender also has important implications in the health sector, and that the final kind of big gap, and the one that we're talking about here today mostly, is that there is a grave inequality when we look at the gender leadership gap. So in a sector where 70% of the workforce is women, there is this complete paradox where there's only an estimated 25% of leadership positions that are held by women. For example, last year, I personally went through all of the Fortune 500 companies and looked at the 40 healthcare companies that were on there, and I saw that there were only 3 women CEOs out of those 40 companies for health on the Fortune 500. During COVID-19, we've obviously seen women who've made very extraordinary contributions to the pandemic response, but women have not, even during COVID-19, had an equal say in decision-making. Typically, COVID-19 decision-making groups have had a small minority of women members. Including equal numbers of women in leadership is important for our health outcomes. It encourages more informed decisions on policy measures, and increasing female talent in leadership can have wide benefits. We think that these wide benefits are not just for health, but they're also for economic growth and gender inequality. Thank you.
Do you see differences in region or level of development in terms of the gender gap?
Yeah, absolutely. So there are regional differences. So WHO has 6 regions, and we do see that there are some very obvious sort of regional differences in terms of what we see in terms of women's participation in the health sector in general. We don't have the best evidence in terms of how this translates into leadership gaps. So what we do know is that, say, in the Africa region, there are fewer women participating in the health sector than we might see in Europe, where there's very high proportion, and then in the Americas as well. But we don't really know how this is translating into the leadership gap. We presume that it would also be the same.
Great. Thank you for that. Dr. Boutin, I'd like to ask you about one way to change the gap is training, and you've been involved with the nurse training program in Haiti. Can you tell us more about that?
Yes, of course. Thank you very much, Joel. Thank you, and good morning to everyone. Good evening. The program, the IT nurse program in pediatric specialization, began in 2015. It was created by Necker Institute of Pediatrician in Haiti, which is related to Necker Institute in Paris, France. The funding was provided by the French Development Agency first, and it is 18 months long training, practical and theoretical also. It was really difficult, to be honest, to build and to have this program in Haiti. I organized everything with all the official minister, health, principally health. I got all the authorization. I just have 2 years to get the authorization. 2 years, and took me to have the first cohort. Finally, this program was designed for nursing staff for the General Hospital in Port-au-Prince, the capital. As you know, that was partially destroyed after the 2010 earthquake. But finally, we have to extend it, the nurse training program to all the nurses in the country, because finally the increased demand for the training of the nurse and because of the infrastructure of General Hospital was still being repaired. So finally, this program trained only nurse young women who are already employed in pediatric services in the hospital in the country only. And at date, it's the first one of its kind to date, again today. For 2 years, I had many difficulty to start the program. And finally, the turning point was when I have the Ministry of Health, who was a pediatrician like me. And she was a woman also, and she was already convinced by the needs of the trained nurses in Haiti like that. So finally, another influence was the coordinator, who was a woman, very active woman, Haitian girl. And because of all these women around me and also women, she has been with us from the beginning until now. And until today, she passed all the examination yesterday and today for the 4th years. So as you can see, it's really a woman-led program on every level, in fact, for this program in Haiti. I cannot hear you, Joel, sorry. Yeah.
I keep cutting it off to avoid noise in the background. How many women have gone through this program so far?
Yeah, the first year we start with 30 nurses who was employed already in Hôpital Général in Port-au-Prince. And the second year also again 30 nurses. And the last year it was 40 nurses who was involved in this program. And we don't know yet if we can probably try to start another year next September, depend of the COVID-19, of course. It was take a lot of delay. It was delay about examination and everything. But it was all these nurses, yes.
Great. Often your program sounds like a typical NGO program with government involvement and third-party involvement. I want to bring Dr. Garfield in to talk a little bit about the public-private partnerships and other innovations in the marketplace.
Yeah, I mean, we work with a public hospital. I don't know if it was a question. We work with a public hospital, and we work Yeah, and we work with, especially for pediatric in Haiti, we have Hospital Saint-Damien with a reference of pediatric. All the children needs to go there. So it's not public, absolutely it's not private, but we work a lot with them. And it was really hard to have some funding for this program, and it was not very big program. You know, Haiti had a lot of big program coming in the country, and it was a little one, but it works. It works really nice, and it works very well.
Let me bring in Dr. Garfield. This government and NGO activity is very common and very needed, but you also work in the private sector. And I wonder, is there an opportunity in the private sector to do partnerships in developing countries like Haiti?
Yeah, first of all, thank you for having me join this esteemed panel of experts. It's so nice to have a conversation about gender equity and health outcomes. And I think, Joel, your question is so interesting in terms of the new partnerships that are emerging with greater frequency by the moment. I think what COVID showed us is that no sector alone can deal with big health issues, especially when we think about health disparities and large systemic challenges like gender inequity. So what we're seeing more and more is a confluence of collaborations between the public sector, private sector, nonprofits, foundations, and others to try to address specific challenges. So a couple to just call out. We're seeing corporations really focus on the health of their populations and health equity more so than we ever have, and considerations like the disproportionate burden of caregiving on women and the need to really understand the social determinants of health and where women are disproportionately affected by certain conditions and comorbidities, as well as the burden for caring for others, whether they're their aging parents, increasingly dealing with issues like Alzheimer's and others, dealing with their children as primary caregivers or as healthcare providers, or both ends of that spectrum. We call that the sandwich challenge of caregiving, and I think it disproportionately affects women. But as we think about this as a systemic challenge, there's also this opportunity for public-private partnerships and collaborations on training and leadership development. We heard from several of the panelists about this challenge, not only that women carry a disproportionate burden of caregiving in outside of the healthcare sector, but within the healthcare sector, it's important to find pathways to growth, development, and leadership, and that burden for training and capability building goes beyond the healthcare sector into academics, public sector, and private sector. And we're seeing people take that on with increasing rigor, which is very, very exciting. And the final thing I'll mention is just really access to care. And we're seeing some wonderful partnerships, both in developing countries and developed countries, around access to care for populations in the most need, and thinking through the funding mechanisms to drive care to those most in need, women of color, families, specifically targets of some of these programs. So just a few examples of areas that we're seeing those types of partnerships.
Are you seeing social entrepreneurs playing a role in developing? These are startups that are a cross between an NGO and a venture capital firm, like there are a number in the US, I know, who've been involved in healthcare issues. Are you working with that, and do you see them having an impact?
Yeah, social entrepreneurship is one of the most exciting areas of growth. It's been around for many, many years, of course, but we're seeing it reinvigorated by both interest and investment from the private sector. So money flowing into these micro targeted initiatives with with people really understanding and being embedded in the cultures they're trying to impact and address. So for example, we've seen great success with some of the micro lending programs, women-owned businesses and funding for other women-owned businesses. It's kind of the classic story of social entrepreneurship and success. It's very female-focused and thriving. We're also seeing great entrepreneurship in bringing healthcare locally and connecting with some of the innovations through digital tools and other technology-enabled services that, again, bring some of the care and technology to local settings where they're going to have their greatest impact in developing countries. So social entrepreneurship, I think, is a great way to have targeted interventions and take funding resources and make sure they're getting to those areas at most need and where they can have the greatest impact.
And are you seeing a significant number of women heading these social entrepreneurship efforts?
Yeah, I certainly don't have visibility onto everything, but we are seeing examples of really exciting women-led initiatives. There needs to be more. There needs to be greater investment in women-led initiatives. So it's not just the volume of women getting into social entrepreneurship, but it's the funding that's going behind those women to make sure that they are successful and become leaders in their communities and bring other women so that it becomes an infectious process globally and certainly in those areas of need. So I would say, Joel, yes, there are women. Yes, it's growing and exciting. This younger generation of female leaders is absolutely tremendous and doing wonderful things, but we need more, and we need the funding mechanism to make sure that we're getting behind them so these initiatives can continue to grow and have an even greater impact.
Dr. McIsaac, do you see you're tracking this these demographics? Are you seeing a change in the number of women in leadership roles, or have you seen any effective programs for training women for leadership roles?
Yeah, so I mean, I think that what we're seeing is that there is a paradigm shift that's happening in health, where we're noticing there are changes in the younger generation coming up that we'll see. Certainly, we see certainly many more women in the sort of higher paid health occupations entering in, many more women becoming doctors. We're seeing more men entering nursing as well. We're starting to see these kinds of shifts happening definitely in the data. But I think in terms of leadership, it's fairly difficult to know because we don't really have the best historical data to show where we kind of started. And I think that this is really topical now, and we're starting to see, but for some of the metrics that we're tracking, we haven't seen huge shifts in the last 5 or so years in the number of women coming up at leadership. We do really feel that this is really getting stuck around that 25% number in those particularly high level leadership roles in terms of leading, the Fortune 500 companies, or in terms of ministers of health or delegates to World Health Assembly or other. We haven't seen drastic changes yet in that leadership, and we think that there's definitely more needed to be done, and I think that there's definitely a lot of space to be making different changes in the system to allow these women to come through. In terms of education and training, yes, there's certainly a lot. Last year was the International Year of the Nurse and the Midwife, and through that we looked at training for nurses into leadership. There's lots going on in that area. We looked at chief nursing officers, countries who have these chief nursing officer positions in place. And then we're certainly encouraging that, but I think at this high level, we need bigger and more done more quickly to see a sizable impact.
Anushka, I wanted your input on is you're building women's leadership more equitably. Dr. Boutin mentioned the fortuitous circumstances of having a female minister who's also a pediatrician. Your programs, what do you do to encourage development of leadership among the women?
In our program, we always try to promote women leadership, especially that our program in the health sector are really focus on health of women and children, and most of the time it goes through empowering women, especially I was talking about Afghanistan, for example. We really try to develop a program to have women as surgeons in Afghanistan. This is something that is such a challenge because women don't have access to study, and when they become surgeons, they just can't have a normal life, and they are obliged to live with their parents. Difficult for them to marry and so on. So this is, I mean, we really fight as well to try to have this gender equity in the access of a high-skilled professional in our medical staff. As well, USFC, as I was telling when we prepared this webinar, we have is led by women. This was not really a choice, but actually all the executive staff, the directors are women, and I'm very happy to work with all this team. This is something really special, even in the NGO world, because I noticed in France where I live, all the CEO of major NGO are men, while a majority of women are working in the NGO. So it's it's not exactly the subject, but I thought it was interesting to talk about it.
Anybody want to comment on building more female leadership? Dr. Boutin? Your mic is muted.
Sorry, thank you. Yes, I just want to add about the program that there is a big impact for Haiti, of course. First, because we can decrease the mortality and morbidity of Haitian children. First, of course, we allowed for women to gain individuality power in social life and in family life also. And this program really empower women. Is really like you said before, studies show that when women are educated, especially like a country like Haiti, in the field of healthcare, there are improvement in hygiene, nutrition, basic health care knowledge and practices. So it provides an income, and it improves the living condition for everyone around these nurses. And for example, in Haiti, nurses are in the front line. As in US and in France, you want to see a doctor, it's much more easier. When in Haiti, especially in rural, very far away from Port-au-Prince, it's really difficult to find a doctor. So sometimes you find some trained nurses and it can save your life. So I'm very proud of this program in Haiti. I'm very proud to have experience like Miss Gina, of course. She joined the program the second year of the program, and she has a very great potential and involvement. And the year after she was graduate, she finally was the head of the emergency room pediatric at Saint-Damien. And I told her about, wow, it's really good. And he said, you know, your program showed all in the hospital that I was capable and I was really good nurses for emergency room children. And that's a big hospital in Saint-Damien of Port-au-Prince. So, of course, we're very proud of this program, even if I told you, Joël, before, I try to not be so pessimist because of the situation of the country. But my coordinator, all the nurses, I have on WhatsApp with her. They pass the examination as I push them to continue and to have a big tenacity, you know, as we have.
You must feel that you're putting a drops of water on a fire in some of these countries, especially like Haiti, where there's so much need. How do you scale up, or what would be ideal in terms of growing your program? Is it something that can be scaled up? Is it a matter of money and resources?
I know. Yes, program can be scaled up, of course. If we have more funding, we can have more training, of course. Indeed, more women with taking care of more child and children. For Haiti, we have so much things to do, but when I had this possibility to organize this program, I was thinking by myself, even some people say, you know, it's a country very difficult. Okay, it's my country, I want to help. And I know that I just help to form 60 or 70 nurses well-trained to taking care of children. And even that, it's okay for me to do that. But of course, we want to duplicate this program in other countries, you know, especially Anushka speak about Afghanistan, Kabul. It could be a place where we were thinking about to duplicate this country. And it's really easier to train nurses much more than doctors sometimes in some countries, you know. And in countries like that lack doctor, a well-trained nurse can save your life. So I think with more funding, of course, with again tenacity like we had, we can help and train much more women and nurses, you know.
I'm going to turn to Dr. Garfield again and ask you about the private sector. As somebody who covered the venture capital industry for a long time, I wondered if the issue of scale in healthcare is as important as it is in other aspects of venture investing. Are you looking at what's the scalability of this particular product or service when you're deciding about financing or partnerships?
Yeah, I think for many in the funding community, they're not only looking, scale is important, but so is the ability to get an innovation into an entrenched system of care and finding funding for it, or understanding how it's going to displace whatever the routine standard of care is. And so I think it's very, very, very different in environments where there's tremendous unmet need, and you have the ability to really leapfrog the current standard if you can bring in something new. So in some cases, those contexts that are least developed can actually absorb innovation much quicker and much better than in a context where you have to work on incremental change. And so I think the investors are looking at how each system has the ability to accept whatever innovation you're talking about, whether it's in the healthcare delivery, whether it's a therapeutic, whether it's a digital health innovation, whether it's in the healthcare infrastructure, buildings, et cetera. So certainly there's an enormous amount of funding going into healthcare around the globe, and that's coming from many, many different sectors. Coming from healthcare itself, with many healthcare providers having their own innovation funds. So they're actually investing in their own research and development pathways. And one of the things that I think is really interesting in terms of this conversation is if you look at some of the leading health systems in the world, certainly this is true in the United States, but also globally, the research coming out of their own academic and research facilities is starting to seed some solutioning around some of these issues around social determinants of health and health equity and gender differentiated care. And we're starting to see that specifically in how some of these organizations are looking at their investments in research. And so we talk a lot about the end game, which is the delivery of healthcare, but there's a tremendous amount of change that's needed in how we invest in R&D for healthcare and therapy, and how we can find more equity in the data and the research and the subjects that are brought into our trials that drive the eventual care on the other end. So I'm actually very excited to see that as something that's starting to happen at scale. To your question about is scale important in how people invest, I think it is, but I don't think that that's necessarily differentiated from a gender perspective. What I do see on the gender side is much more recognition that our current protocols for thinking about value and thinking about innovation don't necessarily recognize that gender perspective, and we're starting to see some of that change.
Let me turn to Dr. McIsaac once more. What strategies or tactics have you found be effective in the real world to promote gender equity? And
so I mean, I think what's interesting is that there's also a really important element of the system which encompasses, you know, all of these programs, all of these choices, all of these investments. And so I think it's really important that we also address that there's sort of a systemic issue or a systems-wide issue that we need to address. And I think that you know, for example, creating a legal foundation for gender equality in the working world is really important. To allow women to actually engage in the world of work is important. We know that around 90 countries still have employment laws that restrict the types of jobs that women can do. We know that 45% of countries have only 45% of countries have achieved gender parity in lower secondary education, and maybe only 25 have achieved it in upper secondary education. So, you know, the pathway within which to enter to become a health worker is unequal before you even into the health sector. So addressing these sort of foundations is a really key element to ensuring that the playing field is equal. Secondly, I think that we have to acknowledge that there's these social norms and these gender stereotypes that really drive a lot of this gender segregation in the health and care workforce. So we tend to see systems which place a lower value on occupations that are majority female. We have gender stereotypes that pervade leadership. So this idea that, you know, men or leadership is sort of more of a man's role. These sorts of preconceptions need to be addressed. And I think there's also a really important role for engaging women and girls in STEM. Then once we're actually in the workplace system, so once we're actually in the system of work, that there's a need for really policies that really address this directly. So gender sensitive recruitment, family-friendly policies that allow women to participate in work, even if they have that kind of care burden at home. This is a really important element that we need to be addressing throughout. And then there's the sort of final step, which would be that there has to be deliberate measures that are in place that enable women to apply for and achieve these leadership positions on merit. So I think there's like a very long pathway that needs to be addressed throughout, and it's not sufficient to just look at one element of this. We need to ensure that once we're there, that there's more in terms of network, there's more in terms of tracking. As I was saying, we don't have, you know, always the best data, and then making your data within whatever organization or system you're in public, and then mentoring programs, as was discussed, are really good examples of this.
Are you seeing funding requirements that address gender equity, where the funder says, I want to see more women in leadership roles?
Yeah, I mean, I think that there's starting to be like a stronger feminist foreign policy coming through from many of the sort of larger donors who are putting an importance on the gender aspects of programs. There are certainly programs explicitly targeting women in leadership, you know, definitely in terms of the health sector, but we don't see I think what's really important is these programs which are intersectoral. So these programs like we're Working for Health, which is a WHO, ILO, OECD program, which looks at it from the different sectors. So it brings in, education sector along with finance, along with health, to create solutions that address the whole pathway of issues. So I think that these programs that are taking this intersectoral lens are really what's needed if we're going to make big leaps forward in terms of addressing these inequities in leadership.
Great. Anybody else want to comment on this before we go to questions? Something we haven't covered that you feel is important?
I'll take the opportunity to quote the Secretary General of the UN, who Antonio Guterres, who said a couple months ago, who said, and I wrote it down, so when I've been trying to say it every time I have a chance, which is, it's time to stop trying to change women and start changing the systems that prevent women from achieving their potential. And I think this is really the direction that we really need to be going.
Great. Question that's come up. What role does opportunity creation have in empowering women in healthcare? I assume this is opportunity creation in private sector or public-private. Anybody?
Yeah, I can take a start. I think wherever the opportunity comes from, there's kind of a few different things for us to focus on, right? Is the system set up so that individuals can take advantage of an opportunity and move it forward and excel either individually or by changing whatever healthcare delivery system they're in to advantage that opportunity? And I think that's what Dr. McIsaac was just saying, which is so critical, that in some cases, in many cases, the system, the structures are not set up to support people in succeeding and taking advantage of opportunities and moving the needle meaningfully forward. So I think in terms of opportunities, we need to think about, are there the support networks in place to support women in leadership and women driving innovation forward? Is there funding in place that will activate good ideas and empower teams to drive forward? Are there leadership cohorts that will wrap around these trailblazing women and help support them and give them the resources that they need, both in terms of ideas and network, but also in connectivity to other power structures that drives change? And are the people in power, wherever they are and wherever they sit, being mindfully active in connecting these opportunities to women entrepreneurs, women leaders, and women innovators? And I think that there's this structure, this ecosystem of activation that we need to really think about. And I really appreciated that quote, because it's not about, are women leading, or what are the numbers of women in leadership position, or how are women innovating? I think the question is more about how are we really supercharging and activating the ecosystems in each of our countries to enable these new approaches to change, innovation, and hopefully with women or gender equity at the core of them. So that's some thoughts related to that question, and thank you for the question.
I think both you and the Secretary General are being polite and saying, without saying it's the men that need to change.
Well, I think it's men and women. I think this isn't a men's issue. It's not a women's issue. It's a human issue. And it's a human context of equality that we're trying to create. In many cases, in many areas, the system is set up to disproportionately and negatively impact women. In some cases, that's less so. So it's a honest look at whatever system we're working within and to take a humanist approach to say that we want to create gender equity and access and opportunity. We also want to do that for our communities of color. We also want to do that for economically disadvantaged people. We also want to do that in access to education. So gender is an example of inequity, but it's not the only one. And so I don't want to just say that men are the problem. I think inequity in general is the challenge.
Do we have another question? If not, I can try to. I think it's been a fascinating discussion. It's obviously a topic that has such profound impact. Our healthcare is so important, and the disparity between the people who are providing the care and those who are leading it. Any reduction of that gap is obviously going to make healthcare better, more responsive, more sensitive to the needs of both men and women. We're glad you're tracking, Dr. McIsaac, this leadership gap. And we're glad that programs like Dr. Boutin are working on the ground to train a whole generation of nurses who will become leaders, as you gave the example of the woman who was put in charge of the emergency pediatric ward. The private sector has been very active in my experience, in developing new concepts, new ideas, and new solutions. We'd like to see more women involved in the private sector, especially entrepreneurs starting out, since the big companies seem too often unreformable, if there's to use this expression. They're resistant to change, let's say. So the startups can be a one-way in and to provide opportunity. Anybody wants to make a last statement? This is your opportunity. Anushka?
Yeah, well,
you.
Yeah, it was such an amazing conversation. Thank you as well, Michelle, Susan, and Laurence. Thank you, Joël. Yes, I know that women accounts for the majority of workers in healthcare, but are underrepresented for the leading position. So, of course, this is also a matter about changing the system. And by promoting the career development, women's health will be seen at the same time higher on the agenda, I guess. And but well, I noticed that gender equity is a human issue, and we all have to know about this. And the USFC is committed to continue facilitating the dialogue and implement programs such as Dr. Boutin's, which we can replicate in other countries, and of course training women as economic and health impact for both women, children, and so thank you very much, all of you.
And thank you, Dr. Boutin, Dr. Garfield.
Thank you very much.
Isaac. It's a great panel. A lot of people have missed a great opportunity to hear some wisdom, but I'm sure it will exist on the internet.
Yeah.
It's being recorded and it will be available.
Okay, thank you very much.
Thank you.
Thank you again, Joël. Thank you, all of you.
Bye-bye, it was a pleasure.
Pleasure.